Before my own doctor's appointments, I will spiral for weeks in advance. I'll replay the conversation over and over in my head. What am I going to say to them? How am I going to say it? How am I going to present my issues to the doctor? And I'll redo the conversation and be like, oh no, I better make it sound like this. No, maybe I'll just say it like that. Should I bring this up? Should I not bring that up? I drive myself nuts. And then I start worrying, am I going to offend them? I don't want to sound like I'm a hypochondriac, Googling my symptoms at 2 a.m. or using ChatGPT as my main medical advice, my main source of medical advice, which I do all of the above. Like everybody. And I know that majority of you listening probably go through something very similar before they have to go approach their doctor about whatever it is they're dealing with, not just hormones. Like hormones puts a whole nother layer on top of it because the medical system does not give us the care that we need and deserve. And we all know this by experience at this point. And so gearing up to go talk to a family doctor about hormones and menopause and perimenopause, it is extremely stressful. And I hear it from you guys all the time that you overthink it as well, and that you were gaslit when you walked into the doctor's office to talk about your hormones. And you tell me horrific stories of what your doctors have said to you. Even when I had a good doctor who was like the most amazing physician ever, I would still do this. I would still go in my head and think out the conversation and, think, how do I approach this without making them defensive? How do I phrase things so I don't trigger their ego? How do I make them feel like they're still the smartest person in the room and in control? Because so much of this fear isn't actually about hormones. It's about how the doctor is going to react and whether their ego is going to get involved, because it often does. And that's a sad reality. And I'm not grouping every physician into this conversation. There are some incredible doctors. Like I said, I used to have a very incredible doctor, and she wouldn't get her ego involved in stuff. And she was always open to learning from me, and she was amazing. So I know that there's many amazing doctors out there, but most doctors, they don't want to admit that they don't know everything, and they definitely don't want to hear about functional or alternative approaches, which, as you know, I'm very into, but it's just not how they're trained. They prescribe, they diagnose, that's their lane. Today's episode is about helping you, my lovely listener, get hormone replacement therapy the smartest way possible. Whether that's through your family doctor, another clinic, or yes, my own program. And I'll be totally upfront with you, as I always said, very transparent, that I do. Of course, I have an HRT program. I'm going to go into it in more detail later for those of you that are interested. But I just want you to know that we do offer it. We just launched 2 new programs. I just want women to get help. And that's always my priority. And if we can help, amazing, awesome. We got the Midlife Reset Basic Care Program. This includes estrogen, progesterone, testosterone prescribed, and thyroid management for one low monthly cost. It's all done through telehealth, and we can prescribe all of those things in every state. As of right now, it is only available in the USA, so sorry, my fellow Canadians and women from around the world that listen to this podcast. I wish I could help all of you. We are in the process now of working on getting something going in Canada, but it's obviously going to take some time, but we are working on it. As part of this program for U.S. residents, you get access to our group coaching program, which includes coaching from yours truly and support from our coach, Jessica Brennan, which the group coaching is actually amazing. You know, you wonder, oh, well, it's group coaching. Am I really going to get help and one-on-one help? And you really do. I should have some of my members just come on here to talk about it so you could hear it from them. But we had a call earlier today, and there's a call every week. And, you know, the women, they sit and we chat face to face on video in the group call, and everybody gets to hear the answers to their problems, which are usually answers to their own problems. So they want to hear about it, and it just can really help you to feel like, okay, I'm not alone in what I'm going through in perimenopause and menopause. Having that group camaraderie is really, truly amazing. We had women, you know, there was a woman that she was really struggling with some body pain and her hormones, and she couldn't get testosterone and all this stuff. She was in Canada, and it was awesome because every single person there was like popping in to the chat box advice for her. They were like, oh, I had that too, and this is what I did, or this is the peptide I used, or here's what I did with my hormones, or whatever therapy they did. They let her know and gave her some advice as well. I did. And you know, that's what it's like when we have these group calls. You really do get help, not just from me, but from all of the members that are at the group call. Same within the forum, people will chime in and say, oh, hey, this is what I did that worked for that. And so you really do get a lot of help, even though it's group coaching. And then you also have the option to always book a private call if you want to meet with one of our practitioners, just one-to-one. And you get it for a discount price for being inside the group. And so that's always an option if you feel like you need more time and more help. You get the online group coaching program. You get all of your labs included for the year and your doctor's prescribing appointments. We've worked out a deal with our compounding pharmacist, and we're getting really, really good prices on all of the HRT. And then our other program is more robust. It's called Total Transformation. And this is for women that want the deeper dive, that have, you know, maybe some possibly some deeper issues going on in their body that need more comprehensive care. It still includes all the prescribing, but it also will include more advanced testing. It includes a gut test, like a really good comprehensive gut test. It'll include a Dutch hormone metabolite test kit, and then blood work throughout the year as well, with advanced testing inside of the blood work too. And you get to be part of the group coaching. So you can get weekly group coaching calls. You meet with our practitioner, Jessica, 4 times throughout the year. And it's a lot of hand holding and deep dive into all aspects of the body, not just the hormones, but we're going for the gut, detoxification, liver, all of those things. Okay, and then I'll break these down a little bit more clearly, like I said, at the end of the episode. I just want you to know up front that we now offer this. Our point was the point of creating the programs was we wanted something really affordable that nobody else was offering, and we have not been able to find another clinic online with better prices than what we're offering. So for all of that, like for thyroid, testosterone, progesterone, estrogen, there is very low cost programs out there that have just estrogen, progesterone, but we have not been able to find anybody that's offering all 4 of those hormones, and including and that can prescribe in every state. So we're really hoping that this will help many of you out. And then the deep dive one is because we saw a need for that too. We've seen so many women over the years that really needed that deep dive, and they didn't want to have to hire a functional doctor plus have somebody else for their hormones. And so we want to bring this all together. And our practitioner, Jessica, she's a personal trainer. She's extremely knowledgeable about all the peptides. And so she's can really help with fine-tuning different peptide regimes and protocols. She's a functional lab diagnostic practitioner. She's a personal trainer. She's a nutritionist. She's a certified hormone coach. She's trained in menopause, and she's been working with me for 7 years. So she knows all of the things that I know from working with me. Anyways, onwards and upwards. In today's episode, you're going to learn how to navigate conversations with your family doctor so you don't freak out. I'm going to take all my own advice in this episode, by the way. I was like, as I was writing this episode, and I was doing some research for it, and I was like, you know what? This is going to help me in my next visit to the doctors, which is coming up soon. So we'll see. We'll see how it goes. I'm going to use my own advice here. But navigate conversations with your family doctor, how to work with nurse practitioners or hormone clinics, and most importantly, how to advocate for yourself without feeling awkward, emotional, or intimidated, or spending countless hours worrying about it beforehand. Because for a lot of women, talking to a doctor about hormones feels very scary. You don't want to sound difficult. You don't want to be dismissed. And you definitely don't want to leave the appointment feeling small or embarrassed for even asking, which happens all the time. This episode is about giving you language, clarity, and confidence. So whether you work with me, with your GP, with another clinic, or a provider halfway across the world, I don't care. You know what good hormone care actually looks like. And once you understand that, then you'll be able to get the help that you so badly could need and do need, which just makes life that much better, doesn't it, ladies? Okay. Before we go any further, I want to get really clear about something. Medical doctors are not the problem, but we have to understand what they actually do and what they don't do. And this will save you a lot of grief. Number one, time. Your family doctor usually has 10 minutes, maybe less. That's it. They're not sitting there thinking deeply about your hormones for half an hour. They're triaging, documenting, prescribing, and then moving to the next patient. Most actually get very little formal menopause training. There was a survey that showed fewer than 1 in 5 OBGYN residents had a structured menopause curriculum or dedicated menopause clinic during residency. And what's really telling, about 70% of those residents said they wanted more training on menopause, hormone therapy, bone health, cardiovascular risk, and metabolism, meaning even they know they didn't get enough. So if you've ever felt like, oh, maybe I'll go see my OBGYN and they're going to know how to treat my hormones, I wouldn't count on it. Same with endocrinologists. Endocrinologists, yes, they're supposedly hormone specialists, but menopause is only a very minuscule piece of what they do, if at all. They are mostly trained in diabetes, adrenals, pituitary, some thyroid, especially like thyroid diseases like Graves. But hormones and menopause, very, very little, unless that's what they've chosen to focus on in their practice, which I have not seen that yet or heard of anybody that did that got help from an endocrinologist that specialized in menopause. I know that it's out there. I just haven't personally come across it. And then when it comes to just your family doctors, there was a great study done by the Mayo Clinic a couple of years ago that showed less than 7% of medical graduates felt that they were prepared to discuss anything about menopause, and none of them felt knowledgeable or prepared about perimenopause. That wasn't even mentioned, actually. So perimenopause, there's definitely no training there. There might be, less than 7% of physicians that will get, medical students that will get some education on menopause. And they are not taught, none of them are taught about bioidentical hormone therapy or compounded hormone therapy. Like, it's just not there. Like, they'll maybe be taught the drugs that are available, which could include bioidentical hormones, but they're not doing any sort of deep dive on bioidentical versus just regular HRT. It's really frustrating. I've heard they are trying to change this. There's been a lot of stuff on the news lately in the States about a group of people that are trying, it was a woman and a couple other people that were trying to make it so that the medical curriculum included more on menopause. So maybe by the end of 2026, we'll see that happening. I mean, we did just see the black box warning come off of the estrogen box, so you never know. But yeah, so that's pretty sad. So I want you to expect that your doctor, your family doctor, is not going to know much about, if any, about perimenopause, and very, very little about menopause. So go in with that expectation, and then maybe they'll surprise you. You never know. I also want you to keep in mind, MDs, family physicians, are not trained in functional medicine unless they have gone out and taken extra training for it. This means they are not trained in nutrition. They're not trained in supplements. They're not trained in lifestyle. They're not trained how to hunt for root cause the way a naturopath or a functional practitioner are. Practitioners. It's not their job. So when women get angry, and I get it, but their doctor says, here's an antidepressant, here's a sleeping pill, here's an antibiotic, eat less, move more. And I've heard all of these from my own doctor. It's not necessarily because they don't care. Well, they might not care, but it's because they weren't trained to manage that. They weren't trained in any of these things. They chose mainstream medical care, not functional care. Use them for what they're good for. Now, the good thing about physicians when it comes to our hormones is they're usually the cheapest route. And so I know that many of you are going to your physicians to get help with your hormones because that is the cheapest option. And maybe you have insurance that covers it. Great. But just don't expect that they're going to know anything about it. So let's figure out how we can approach them to get the best care. And I don't want this to be about bashing doctors. We need them. We rely on them. You got cancer, you got a broken bone, an infection, a serious illness. Thank God for modern medicine. Like, we absolutely need it, but just know their box that they're in. And so you don't get as frustrated, because women get really angry. I can't tell you how many times I've heard somebody say like, my doctor just prescribes medication. It's just pill after pill after pill. Well, that's what they're trained to do. That's what they do best. And so don't get angry about it. If you want functional care, go to a functional doctor. That's all there is to it. That's the only option. Or find a doctor that's willing to work with you. That too. Okay, so why does this feel so hard in the first place? Because it's not just you being sensitive or overthinking, or myself being oversensitive or overthinking. It's the environment. You've got the 7 minutes to very quickly explain all of the stuff that you're going through. And then there's history of past experiences with our doctors. So many women have felt so dismissed by their doctor in the past. We're looked at like the crazy emotional woman. It's so unfair, but it's true. And there's stats that even show that women are dismissed more than males are. We're gaslit all the time. Your labs are normal. This is just stress. It's part of getting older. This is so normal because you're in menopause. This is normal menopause. It's like, just so because it's normal to suffer that we should be suffering, And I always say this. Once again, if this was a man coming in and complaining that to a male doctor, especially like, doctor, I can't get a hard on anymore. Do you know how fast they're going to write that prescription for Viagra? Really, really fast. Here's your Viagra. Here's your testosterone. What else do you need? When women are, it's like, yeah, well, this is normal. Your labs are normal. Like every single woman that comes to me that has been to their family physician, most of them will tell me that they heard that at some point from their doctor. Your labs are normal. Even though they had their hormones checked and they're in menopause, but because their levels are in menopause range for their age, that to that doctor, well, that's normal. It's not normal. But after hearing that a few times, we start to doubt ourselves. I know I do. You walk into appointments already braced for resistance, already minimizing your symptoms, because women are so good at that too. Already telling yourself, well, don't be difficult, don't be emotional, don't ask for too much. We don't want to offend the doctor. We don't want to hurt their ego. And we're also very afraid of being labeled by the doctor, right? Anxious, dramatic, depressed, hormonal, high maintenance. So we edit ourselves in the exam room. And then there's the power imbalance. Most women were never taught how to advocate for themselves medically or really anywhere. We were taught to be polite, to be agreeable, to trust the authority in the room, even when our body is telling us something totally different. If you caught my first episode of the year, which was my year in review, I talked about how I really had a very hard time last year with this exact thing, with authority and with, sticking up for myself and speaking my mind. And because I didn't want to offend anybody and I didn't want to hurt anybody's ego and, tiptoed around them, and how I had to get over that, but I think that this is conditioning, but it's also just, it's in our nature as women because we're caretakers. We are more emotional. So we don't want to disrupt. We hate disrupting. We hate confrontation. Because if we do, what happens? We're called emotional. We're called lunatics. We're called whatever bitch. Like all the things. Oh, she's such a bitch because she said that. When if it was a man, that probably wouldn't be looked at the same way. Anyways, before you walk in, just know this is not a confrontation. You're not challenging your doctor. You're not questioning their intelligence. You're trying to collaborate with your doctor. You are bringing information about your body. They are bringing medical training, and both matter and both belong in that room. And this is the mindset shift I want you to carry into every single hormone conversation from here on out. You're not asking for hormones. You're asking for informed care. That one shift alone changes how you show up and how the conversation unfolds. Okay, so now you understand what doctors do, what doctors don't do. The next question becomes, what should you actually be looking for then in a hormone provider? And again, this has nothing to do with whether they're an MD, an NP, or working in a private clinic. This is about how they think. First big one. They understand the difference between perimenopause and menopause. These are not the same thing. If someone treats them like they're interchangeable, that's a problem right out of the gate. A good provider is also going to look at symptoms and labs together and not just hand you a lab report and say everything's normal, you're fine. If your labs look okay, but you're not sleeping, you're anxious, gaining weight, and feel like a stranger in your own body, that has to matter to them. And same with the opposite. A lot of doctors won't even test your hormones, and they'll just give you the HRT, which great, they're giving you HRT, but we want testing, ladies. We do. We want testing. Trust me. Labs tell us a lot. And we want optimized labs. And you're not going to get optimized hormone levels unless you're watching the labs and also the symptoms. They should also be comfortable talking about bioidentical hormones and not act like it's some fringe topic. I can't tell you how many times I've heard that from my members and our patients that, they asked for bioidentical hormones and the doctor just had no clue what they were even talking about, have told them to go elsewhere. I had a client actually be told by her doctor, if that's what you're interested in, go see somebody else. Like, how brutal is that? Blows my mind. So you want them to not look at you like you're speaking another language when you say, I want to know more about bioidentical hormones, what my options are. They need to know what bioidentical hormones there are and their safety profile. And they should talk about how hormones are delivered. Oral versus transdermal, that's not a minor detail. It matters for safety, effectiveness, and how you feel. If route or delivery never comes up, that's a red flag. Now let's talk about the green flags, the stuff that makes you think, okay, this person actually might get it. It actually might be okay and do a good job. They ask about your sleep, your mood, your weight, your libido. That's huge. Your focus and brain fog. Not just, are you having hot flashes? And that's it. So a lot of them, you have to remember, they have the same training in hormones and HRT, very similar to what the layperson knows. And what does the layperson always relate perimenopause and menopause to? the only couple symptoms, weight gain, hot flashes, maybe sometimes emotional, a roller coaster ups and downs. That's pretty much it. And so know that there are over 100 documented symptoms related to the drop of hormones in midlife. 100. Now, I'm not expecting the doctor to ask you about all 100 of these symptoms, but just so you know that if you've suddenly got some new weird thing happening in your body, it could very well be related to perimenopause and menopause, and you want to be able to talk to your doctor about this. And even if they didn't know that that was a symptom, you could point that out to them, like, actually, this is a symptom of hormonal loss. And for them to be open to hearing that is super important. They're willing to start low and adjust and move up in dose. You don't want the set it and forget it. You don't want minimal amount just to get rid of the outward symptoms like hot flashes. That's typically not enough to protect your bones and your brain and your heart and all the other systems in the body. You need typically a little higher doses in order to get those effects from hormones. So open to moving that dose up till you are optimal and not being afraid to increase the dose, but they're still willing to start low and monitor your symptoms as you're going along. Like, you want them to say, come on back in 3 months so that we can see how you're feeling and see if we need to adjust the dosing. 3 months is usually like the perfect amount of time to see kind of where all the hormones are going to settle once they start working synergistically together. So if you put estrogen, progesterone, testosterone, and possibly thyroid all in at once, you are going to want to wait and see a couple months. How are all these going to start playing with each other and interacting with each other? And then where is it going to settle? And how are you going to feel? And what are the symptoms that are still kicking around? Which are the ones that have relieved? Do you have new things that have popped up, problems that could be from one of the hormones? And so you want them to say, come on back in 3 months and let's see what's going on. Let's retest everything on the hormones and see where your levels are at. More red flags would be you're too young for HRT. That's a big one. Just wait until you're in menopause, or I can't give you hormones until you're in menopause. Oh my God, that is so old. Stop. I'm really trying to change that. I've been beating that drum for a long time now. Because even functional practitioners, naturopaths, there's still many of them, majority of them will say, oh, I can't give you hormones until you're in menopause. And that is not the way to go through perimenopause. Perimenopause is when we have the most symptoms and we're suffering the most. And if we can catch these hormones before they drop, then you're going to be so much better off, and you're not going to, gain the 20 pounds or whatever, gain the weight, have insulin resistance, the cholesterol goes up, like all of the things coming down the pipeline from the loss of those hormones typically start well before you're actually in menopause. So we want to catch that beforehand. So if they say, oh, you're too young for HRT, let's give you a hysterectomy instead, or an ablation instead, or your sleeping pill, your antidepressant instead. No, those are just the biggest red flags. Let's see. And if they give you a time frame, like, oh, you can't start hormones because you are 10 years post-menopause. Yes, you can. Number 2 is, after 10 years post-menopause, you have to stop your HRT. So if they have that belief and they're not willing to change that, red flag. Because the Menopause Society has now changed that, because it was based on old types of HRT where you were swallowing your estrogen and you were taking a synthetic progestin. And that showed that after 10 years, they saw an increased risk of heart attack and stroke from being on the oral estrogen and the progestin. The one-size-fits-all dosing. That's another one. Big red flag. We're not carbon copies of each other. So don't be, if the doctor is trying to fit you into some mold of theirs, you need to ask that they see you as an individual and that you need individual care, and that, and ask them, are you open to other means of prescribing? And this happens. This happens in the functional world, in the hormone clinics, where I had one woman, a nurse practitioner, who told me I was looking to hire her. And she said, I only will do oral estrogen. And I was like, but why? Like, oral estrogen increases the risk of heart attack and stroke. Why would you want to prescribe that when we have the option of doing transdermal bioidentical estrogen? And she was just like, no way. And many physicians, I would say majority, 99% of medical doctors that are not trained in hormones, I would say almost 100% will have no idea about progesterone sensitivity, which is typically more prevalent in women that use oral progesterone. And so if you have a history of having progesterone sensitivity, or you have it, you're going to want to see somebody that understands that for sure. Okay. So what do you actually say to them? Because knowing all of this is great, but once you're sitting on that paper-covered exam table, your brain can go completely blank. I never say what I was preparing myself to say for weeks in advance. Never. So let's walk you through this step by step. Before the appointment, you're going to do a little prep, but don't overdo it. First, don't walk in cold. You don't need a binder or a 10-page essay, but you do want to be clear. Write down your main symptoms: sleep, anxiety, hot flashes, weight gain, brain fog, mood, libido, whatever applies to you. Write it down. And think about your goal. Is it better sleep, feeling like yourself again, preventing long-term issues like brain or bone health? The clarity makes the appointment go smoother. So be very clear about what the symptoms are, what you've been going through, and what the goal is for you and your health. And then clearly write that down. How to start the conversation. Here is a simple, non-threatening way to open the conversation. My quality of life has really changed over the last year, and I'd like to talk about whether hormones could be part of the solution. This alone will set the tone. You're not demanding anything. You're opening a discussion, and you're not saying, I was Googling last night and I think I have XYZ. I think majority of doctors immediately stop listening to you if you say those words. If you want to be more specific, you can say something like, I'm experiencing symptoms that I believe are related to perimenopause, and I'd like to discuss hormone replacement therapy options. Or I've been tracking my symptoms and they're really affecting my sleep and mood. I'd love to explore HRT as an option. So notice the language there. Calm, direct, confident, no apologizing. If they say your labs are normal, this is a big one. I understand the labs are in range, but my symptoms are still affecting my daily life. How do you usually approach that? This keeps the conversation open instead of confrontational. If they push back or dismiss the idea, try this. Can you explain your reasoning for not recommending HRT in my case and instead XYZ? So if they're like, well, let's just start you on the antidepressant, or let's just start you on the sleeping pill, that's something you could say. You could say, could you just explain the reasoning why you're not recommending bioidentical hormones instead of these medications? Because then they might have to admit that maybe they're not familiar with bioidentical hormones, which then could open it up to, would you be open to like learning more about this? And if needed, you can say, if HRT isn't something you're comfortable managing, would you be open to a referral to someone who does? This one, that way you're not arguing, you're just asking for support, which will be nice on their ego because you're still asking them for help. You're asking them for support. And now if you want to mention specific hormones, you could say, I'm interested in learning more about, say, transdermal estrogen and bioidentical progesterone. Is that something you prescribe? I like that one. Is that something you would prescribe? And then you're putting the ball in their court. So like psychology wise, it's like you're not demanding, you're not being difficult. You're asking, hey, is this something that you would consider? So what not to do? Try not to over-explain or justify yourself. Don't lead with, I read online, I heard on a podcast, Karen said on her podcast that, no, don't ever say anything like that. And don't shrink. You don't need to convince them you're worthy of care. Let me say that again. You don't need to convince them you're worthy of care. If the appointment still goes nowhere, sometimes despite doing everything right, and the answer is still no, you can ask for documentation of the decision, a referral, or simply say, okay, I'd like to think about next steps. And then maybe you go elsewhere, unfortunately. If they're not willing to help you and they're being very upfront about that, then I think that that's your cue to not get angry and be like, okay, they're not comfortable with this. I have to now go elsewhere for it. You tried your best, but maybe they'll surprise you. Maybe they'll be open to hearing more about it. And you could be more specific if they know just like absolutely nothing, but they are open to learning or hearing more, or having you say what you would like to try, then amazing. That you stick with that doctor. And then you can say, okay, great. Like I've been reading a lot about this. I've been reading about the WHI study and how their findings were, misconstrued, or, you could have some backup material that you could hand to them, about the WHI study. I've got lots of references in my online ebook, my user guide ebook, hormone user guide. I will link to that ebook in the show notes. And at the back of it is a list of different research and studies that have been done on hormone replacement therapy and the safety of it. And so you can always copy and paste and just say, here's the great, or let me email them to you, the links to you, and you can read about some of the studies that have been done, some of the better studies that have been done on hormone replacement therapy. I don't think there'll be too many doctors open to that, but you never know. So let's talk about what happens when women go outside the traditional medical system. So let's say it doesn't work with your medical doctor, or you're just like, you know what? I would rather go see a nurse practitioner or go to a private hormone clinic or a naturopath or a functional doc. First of all, paying out of pocket does not automatically mean you're getting great hormone care. I think that's a very common assumption, like, oh, I'm paying, so they must be experts. And unfortunately, not true, especially in the world of hormones. Now, naturopaths and functional practitioners obviously are far better usually than MDs when it comes to hormones. And they generally have more training on hormones than MDs. But there's still some limitations. In many provinces, for instance, in Canada, I'm not sure about the United States, but I know here in Canada, naturopaths, they can prescribe estrogen and progesterone, not testosterone or DHEA. And testosterone, as you all know, incredibly important for midlife women, energy, mood, libido, muscle, motivation. And so that's kind of like that's too bad about that. And so if you are wanting testosterone treatment, then you have to go to somebody other than a naturopath. And then my advice is, if you are going to see a naturopath, ask if they specialize in hormones, or go on their website, see if they specialize in menopause and perimenopause and hormones. A lot of them will specialize in fertility, but you want somebody that has specific training and has done extra training outside of naturopathic school on bioidentical hormone replacement therapy, menopause, and perimenopause. Okay, nurse practitioners. In my experience, nurse practitioners who specialize in menopause and perimenopause are often excellent because they have to do extra training. They are not taught about menopause and perimenopause and bioidentical hormone replacement therapy. So if they're wanting to go into practice on their own and they want to specialize in menopause, they have to go get the extra training for it, and they will. And so you usually will find the nurse practitioners that have done some sort of extra education in this subject. If they haven't, that could be a red flag, and you're going to want to know, where they did do their training or how they know about hormones, and, are they self-taught, which nothing wrong with being self-taught. They can typically prescribe testosterone. In Canada, they can. In most provinces, not all of them, I think, not 100% about that, but I know for sure they can in Alberta, BC, and Ontario, maybe Quebec. And then I'm not sure about the other provinces. In the United States, it differs from state to state, and if they have their license or not to prescribe testosterone. So some of them can only do estrogen and progesterone because they don't have their license to sell. What additional training have you done in menopause or HRT? Are you trained in functional medicine? Do you treat symptoms as well as labs? Are you open to testing? Are you open to adjusting dose and delivery if something isn't working? You can ask all of those questions, and you want the right answers for them. And then form matters. You want to ask, what forms of HRT do they use? Do they only prescribe oral estrogen? Do they use transdermal options? Do they use pellets? And let me say this clearly. Pellet clinics often use one method and one method only, and many are not open to using other forms of HRT. At least that's been my experience. I don't want to throw them all under the bus on this because I'm sure there's some amazing pellet therapy clinics out there that are open to using all different forms of HRT. But what I've seen and experienced and heard about, it's pellets or nothing. It's pellets are going to have the estrogen and testosterone, and then they'll usually give an oral progesterone. And you just don't want that. Oh my gosh. For some women it works, but yeah, anyways, we're not here to talk about pellets today. So any private provider who isn't open to adjusting form, dose, or approach, if you're not doing well, that is a red flag and your sign to go elsewhere. And then don't forget about thyroid. Thyroid gets missed all the time in midlife women. Thyroid issues are incredibly common in perimenopause and menopause. We call it thyropause. So you want to ask, can you prescribe thyroid medication if needed? Do you understand how thyroid works in the body? How, T4 to T3, because so many will just test TSH. They won't even look at free T4 or free T3, and that is wrong. So many will only prescribe T4 medication. Most of them only do. And so you want to know that they are open to looking at all the lab, free T3, free T4, TSH, and open to prescribing desiccated thyroid, T3 only. And I know that you think, oh, well, I don't think I have a thyroid problem, so I don't even have to ask that. But if you've been gaining weight, if you've been feeling tired, having hair loss, dry skin, foggy brain, which, yes, these are all symptoms of low estrogen too, but it can be from thyroid going down. And I would say, with all my experience with this and all the women that I've worked with, I would say about 50% of women develop a sluggish thyroid or a sluggish conversion in midlife that never had a problem before. And suddenly they're not converting T4 into T3 very well. And a lot of the time we wait for the first 3 months before giving them thyroid medication because a lot of the time we just need to get those sex hormones back up. And when the sex hormones come back up, thyroid starts to function better. And so if that's the case, you kind of want to wait and be like, okay, let's optimize the hormones first and then move to thyroid. And so finding a physician that is familiar and open with treating thyroid is really important. Very hard, though, to find. So there's great providers out there, NPs, naturopaths, clinics, but none should be automatically put on a pedestal. Just remember that. And you're looking for someone who specializes in women's hormones, is open-minded, is flexible with protocols, not rigid, open to starting you on HRT before menopause hits in perimenopause, or starting you if you're well into menopause on HRT. Actually, my last solo episode was all about timing on your HRT. So if you didn't listen to that, I would go back and listen to that, especially if you're in perimenopause, you want to hear it. You want somebody that explains their thinking and what it is that they're thinking is a good idea for you at that time, and adjusts based on how you feel and labs. So credentials matter, experience matters, openness matters. So when you put all of this together, there's a really obvious gap, and it's not just access to prescriptions, it's education. Most providers, even well-intentioned ones, don't have the time or don't want to make the time or training to educate you or themselves. They're not walking you through why you feel the way you do, how hormones interact, or how to troubleshoot when something isn't working. And that is why so many women end up frustrated. They have a prescription, but they don't have clarity. They're told what to take, but not why. And when you don't understand your hormones, you don't know when something is off, when to speak up, or when to push back. Because you don't even feel confident that they're going to know what to say or do. And I will tell you, in most cases, when it comes to HRT, when you get started, there is a period of time where you have a lot of questions, that you are going to have many different symptoms popping up and weird reactions, and then positive and negative, that you're like, is this the hormones? Is this because I did this? Is this because I changed the dose? Is this because I took it at nighttime? Is this because I took it in the daytime? Why am I breakthrough bleeding? Why are my breasts sore? Is this normal? I can't sleep suddenly. I'm sleeping too much. I feel depressed. I feel super happy. There are so many different things that will likely come up. Majority of women have things that need sorting in the first 3 to 6 months, sometimes for the first year. So you want to be able to depend on whoever your practitioner is to help you with whatever it is that comes up, and that monitors and is willing to readjust and to change the delivery form and do whatever it takes to make sure that you feel your best. Okay? Just a few more red flags that I thought of right at the end of writing this episode. And that is, if a provider, refuses to use bioidentical hormones, and some women, they don't know what classifies BHRT. And if that's you, then ask, and you're not sure if what they gave you was bioidentical, ask them, hey, is this bioidentical hormones? If it's prometrium, that's bioidentical. If it's utagestrant, these are progesterone, that's bioidentical. If it's progestin, trying to think of some names. Birth control pills are, of course, not bioidentical, and they're often given. The IUD, the progesterone IUD, the Mirena, not bioidentical. Estrogen, you're looking at Premarin. That's not bioidentical. That's horse's estrogen, old HRT, still given out. There's one combo patch that's not bioidentical. So be careful of the combo patch. But most all, I think, or all of the estradiol patches, if it says 17 beta estradiol, that's bioidentical. So with most patches except for the combo patch, estrogel is bioidentical, Divigel is bioidentical, testosterone's bioidentical. Okay, I think that sums them all up. But if you're not sure, ask or go home and Google it and see, is this bioidentical, whatever it is that they gave you. If they try to replace HRT with birth control, red, bright red, flashing flag. Run the other way. It just blows my mind how many women are offered birth control before they're offered bioidentical, so body identical hormone replacement therapy. No, let's just give you the synthetic birth control that destroys your gut. Not destroys, but it does cause leaky gut. It causes nutrient deficiencies. It causes shrinking of the brain. It increases your risk of breast cancer. And yet they hand it out like candy without any warnings of anything. It's terrible. But oh, God forbid you take hormone replacement therapy. If they're not familiar with the Women's Health Initiative and the new research that shows that estrogen can be breast protective. Like if they say to you, hormone replacement therapy causes cancer. It's from the WHI study. Not true. Okay. And then that's a red flag. They're not up on the newest findings of the WHI study. If they don't test your hormones or reassess how you're doing, red flag. If they combine estrogen, progesterone, testosterone into one cream, I don't like that. Not one little bit. I really don't like that. So you don't know what's doing what, and you don't know if if you need to increase one or not. Like it's just terrible. If they don't ever test or reassess how you're doing, tells you to stop HRT 1 day a week or take breaks just because you need to take a break. That's not true. Like progesterone, if we're trying to mimic our natural cycle, we want you to take a break for a week or two, just like it does in the cycle. But if this whole like one day out of the week or 1 week out of the month doesn't make any sense biologically, like that's not what we do when we are producing our hormones. I couldn't go without my freaking estrogen for a week. Are you kidding me? I'd be hot flashing all over the place. I'd be miserable. Naturally, we produce estrogen every single day. We naturally produce testosterone every single day. So I'm going to take it every single day. I don't need to take a break. Progesterone, naturally, we don't produce a lot of it in the first half of our cycle. So I take a break from my progesterone. But there's a lot of women that don't take breaks from progesterone either, and they take everything every single day, and they do wonderful. Okay. Okay, so I want to just spend a few minutes now walking you through our programs because they exist for one very simple reason, you guys. We've lived this. We're not just trained in hormone health. We are an all-female team that specializes in perimenopause, menopause, and midlife care. It's all me and Jessica do. We are your coaches, and I tell you what, we've been living and breathing this 24/7 for over a decade. And then my entire staff outside of the practitioners are all midlife women. So they all understand menopause and perimenopause, and that's very important. We try to approach this in a very functional way. So it's not just about going to the doctor and getting the prescription. We want to give you ongoing support, education, and adjustment because hormones change and your care needs to change with them. Our programs are built around ongoing lab testing and symptom monitoring. Expert HRT coaching paired with licensed prescriber oversight and prescribers that have been trained in HRT and thyroid care. And then thyroid, we know how important thyroid is, and we make sure that we pay attention to the thyroid, which not very many HRT clinics offer, and we do. The Midlife Reset program includes essential hormone and thyroid labs with additional thyroid testing available if needed. In the Total Transformation program, we do much more comprehensive testing. You're going to get a Dutch complete test. That's the urine metabolite test on the hormones that you take once you start taking the HRT. So 3 months to 6 months in, we'll get you to take the Dutch test so we can see where your levels are at, where the adrenals are at, which is super important. Organic acids test is on there as well, and how you metabolize those hormones. And so that's an amazing test that I think every woman should get at some point. And then you also get the gut Zoomer test because gut problems are so prevalent, and we want to see how you're breaking down the hormones, how's your gut integrity, and so that we can make recommendations for anything that's going on in that area. It includes private one-on-one coaching sessions with Jessica, private coaching call with Jessica. She'll help you dial in all, any sort of peptides that you're interested in. If you're not interested, then you can have that appointment for something else. But yeah, so 2 very clear paths, because not every woman needs the same thing. Some women just want the straightforward, affordable way to get properly prescribed HRT with guidance and support. Others need a deeper, more functional approach because their symptoms are complex or stubborn. And that is why we offer 2 different programs. We still do offer just the group coaching. If you don't need a prescriber, we can still offer our group coaching program. That's not going anywhere. The midlife reset essential hormone care, if you are on a budget, you're comfortable with group coaching, you're going to ask for help in the group coaching calls, because that's where you're going to get your coaching from. You don't have complex health issues. You want just safe, guided HRT without piecing everything together. You'll get 4 prescribing visits with an HRT trained doctor or nurse practitioner in the year, 4 essential lab panels, including the estrogen, progesterone, testosterone, thyroid, access to estrogen, progesterone, testosterone, and thyroid, prescriptions through our partner compounding pharmacy for a discounted price, weekly live group coaching and Q&A with me and Jessica, a supportive community, plus our Mastering Perimenopause and Menopause online course, weekly metabolism and midlife friendly meal plans, step-by-step guidance on peptides, and an online workout library to protect muscle and support fat loss. This program exists because most women end up spending thousands of dollars trying to piece this together and still don't feel great. And if you're somebody that has tried to DIY it and not getting very far and you want that help, this is a great place to get it, and one of the most affordable places to get all of the care for all of those hormones. And then the midlife transformation. If you're dealing with things like PMDD, hypothyroidism, Hashimoto's, PCOS, gut issues, hysterectomy, long-standing symptoms that haven't responded to basic care, this program's for you. It includes 4 private coaching sessions with our lead HRT specialist and functional health coach and peptide expert, Jessica, personalized protocols using HRT supplements, peptides, and lifestyle strategies, access to Jessica between sessions, 3 comprehensive blood labs, a gut zoomer panel, a Dutch test, and all necessary prescriptions, including HRT, thyroid medications, and even low-dose naltrexone, plus full access to everything in the Midlife Reset group program, where you can do everything that was included in our basic program is also included in this program. So pretty extensive, that one. So if you're looking for that full body transformation, that'd be the one for you, and that you can apply through a discovery call. I'll put the link in the show notes. And if you're interested in the Midlife Reset Basic Care Program, you can get started today, like right now. I'll put the link in the show notes, and you just take a little qualification, little test that takes like 10 seconds. And then if you pass, then you go on to the next step, which is filling out our form, and the doctor will reach out to you, and you'll be able to book your appointment. You'll get your first lab requisition, and instructions on how to log into the program and everything else that you're going to need. And so you can get started on that, like I said, today, if you so wish. All right, ladies, whether you choose to work with us or not, my goal with this episode was simple: to help you understand what good hormone care actually looks like, and what you can ask for or look for in a good hormone practitioner. If you do want support from us, both programs are linked in the show notes, and you can check your eligibility in under a minute. And if not, you're still walking away informed, empowered, and hopefully better prepared to advocate for your body. I know I feel more prepared. So that's always the goal. Thanks for tuning in, ladies.